Hi, Eve. Good to see you again. How are you feeling today? Great to hear. Let's continue chatting about atrial fibrillation. Let's talk about the causes of atrial fibrillation. Atrial fibrillation gets to be more common as people get older. In fact, about 1 in 4 people who are elderly have AFib. A lot of things can cause atrial fibrillation. Well, high blood pressure, diabetes, and heart attacks can lead to getting AFib. These are the most common reasons overall, but there are other things too. Lung problems from smoking or having surgery on the heart or lungs can also lead to AFib. Sometimes it is not clear why somebody has AFib, but the important thing is to know how to take care of yourself to avoid problems that can come from having AFib. For example, atrial fibrillation can lead to strokes. Preventing a stroke from happening is very important. Many people with AFib take a blood thinner to avoid a stroke. A blood thinner can be inconvenient. I know that. There are blood tests, and you may have to worry that your blood is not too thin. That means checking yourself for signs of bleeding. But overall, I think that it is better to take these medicines and avoid strokes. Well, there are several signs of bleeding. First, it makes sense to look in the toilet bowl after you go to the bathroom to see if there is any blood in the bowl. Sometimes, if your bowel movement turns black like tar, this can also be a sign of bleeding. If these things happen, or if you have other bleeding that does not stop from a cut or from your gums, you will need to call your doctor. Excellent. Is there anything else you would like to talk about? Okay, what symptoms have you been having? Sorry to hear that. When did you last feel this way? How bad was it? Let's say that 0 is not bad at all, and 4 is the worst you can imagine. Do you have any medicine to help you with the palpitations? Please talk to your doctor to help you with this. It is important to see how these symptoms relate to your heart rhythm. Can you take a reading after we finish this session? Great. Your heart rhythm will be reviewed by the medical team. After 30 days of the study, the team will put together all the information they gathered and inform your doctors about your symptoms and heart rhythm. To ensure your doctor gets a complete report, please share as much information as you can with me. Do you have another symptom that you are experiencing? Is there anything else you would like to talk about? Until next time. Bye.